It was probably like 2 a.m. or so. I was in one of my patients' rooms, about to pass some meds. And I'm looking at the computer screen. And out of nowhere, the screen just goes black. And it pops up, run, hide, fight on it. Oh. And I'm like, excuse me? They received a text that there was an active shooter in the building and that's all that they know.
Hey guys, welcome to Nurse Talk, the podcast where we talk all things nursing. I'm your host, Mia, and today I have Kayla.
Hey guys.
Thank you so much for being here.
Yeah, thanks for having me. This is so much fun.
Of course. So I like to ask people what they did prior to nursing, what kind of jobs that you had.
I actually didn't have, I obviously worked before I started nursing. I mean, I would hope that, but I actually became a nurse pretty young. So I didn't really have a full-blown career before I became a nurse. Nursing is my first career. When I was much younger, I was a gymnastics coach just because I did gymnastics when I was younger. And then I worked at some restaurants throughout college, smaller things like that. And then when I was in nursing school, I was a CNA just for the 2 years that I was in nursing school. Yeah. And then I became a nurse. So I actually became a nurse when I was 20. So I didn't really,
Oh my God, that is so young.
Yeah, I know. That's what everybody says. And I know it's young. The joke at the time was that, I could give all these crazy medications and life-saving things, but I couldn't even go down the street and buy myself a beer.
Yeah,
so
that is
it was pretty crazy,
yeah.
But it wasn't very long. It was just a few months. My birthday's in September and we graduated, before the summer. And so it was a few months of working while I was 20 and then I turned 21 and then I've been a nurse ever since.
I work with like 21-year-olds too. And I'm like, oh my God, they're just so smart. They knew exactly what they wanted to do. So young. Like I wish I didn't know what I wanted and I bounced around and I wasted a lot of time when I could have had like this. I think nursing is a great career. So I could have gotten straight to it and I was just kind of lagging around like, getting degrees and stuff that isn't going to pay and, all that stuff. So that's awesome.
Yeah.
My follow-up question was going to be, do you think that those jobs, shaped you to become a nurse? And being a CNA, of course, would definitely help.
Yes, definitely being a CNA. While I was a CNA, I didn't work as much as probably a typical CNA would. I just kind of, because I was in school, I would just work probably, I think it was either once a day on the weekends or like every other weekend just to kind of get my foot in the door at the hospital system that I wanted to work at and gain a little bit of experience. I definitely wish, I don't have any regrets, but I definitely wish looking back that maybe I would have done something in healthcare a little bit longer or, worked a little bit more prior to starting nursing just to be able to get my feet wet a little bit more and kind of understand it. But that's just for me personally. I definitely don't think you have to do that. I think you can just jump in, go to nursing school and become a nurse and be great at what you do. So
it just takes really like a lot longer to feel comfortable because I look back and, my little group in nursing school, all of them were PCTs, but I was not.
Oh, okay.
And I could definitely tell that there was a knowledge gap, at least in terms of like the hands-on care. They can make a bed and do all this stuff without even thinking about it. And I'm sitting there doing like the most basic things like, wait, oh, okay,
Yeah.
So I think it does make a big difference. And I definitely wish I would have done that as well, started as a PCT or a CNA.
Yeah.
But it's also very difficult because they get paid such a little amount. So you kind of have to like...
And they do so much, Now, especially if you're a CNA first, I think you have a little bit of appreciation for that job. Some, you hear mixed reviews. Some nurses, they will, ask the CNA to do a lot of things just because they assume that they're on different tiers, which is absolutely not true. And you guys have to work together. And if you're a good team, then you have the best outcomes for the patient ultimately. But I think having that job initially helped me as a nurse to be able to appreciate those positions and then to be able to, what's the word? I wouldn't say tell them what to do.
Yeah.
I'm still so bad at that. Honestly, that's one thing that I've never, and I think being young was really hard for me because you come in at 20 and then you have, maybe a CNA who's been doing this for 30 years and they're a boss at their job. And then I come in, I'm like, hey, can I get some help in room 20? And they're like, who are you? Do you even know what you're doing? So
I still experience that because I the day after I passed my NCLEX, I showed up at a COVID job at like 6 a.m. I had no experience, no PCT experience, no nothing. And I went to school in the middle of COVID where I had hardly any clinicals. I mean, I really knew nothing. And I remember it was like not even 24 hours since I had passed the NCLEX. And I show up and they're like, who's the nurse on, who's the RN on site? And I'm like, and then
you're like, who?
And so everyone was either like a CNA or an MA. Mm-hmm. And I remember I was the only RN, I was actually the only RN. And I remember people double my age were coming up to me and being like, can I go to the bathroom? And I could just feel the animosity growing where they'd have to ask me all these dumb questions. And I'm like, I'm 25. Like,
yeah,
please don't ask me to go to the bathroom. Like, this feels too weird.
Yeah.
Like, almost immediately I felt like, ooh, like uncomfortable.
Yeah. Mm-hmm.
So I can't imagine how even worse that would feel. Like in a hospital setting, 20 years old, with someone who's worked there for a very long time being like, hi, I need you to go do this. Like, I'll just do it myself.
Yep. Yeah. And I have that since I float around, I float to different areas, so I don't work with the same team all the time.
Okay,
so I'm always getting different people, different personalities. And sometimes that goes really well. Sometimes it meshes. I think, one thing that helps is pretty early on to obviously introduce myself and then say, if you need help with anything, let me know. And then usually they're like, oh, same here, But then I also, any chance that I get, I'm doing anything to make their job easier. And then I think once they notice that, they are more willing to come and help me with things because, it's not two separate groups. It's all about taking care of the patient. And so, whatever way that looks like.
Oh, yeah. They probably really appreciate that.
Well, I hope so. No, I'm just kidding.
So what ultimately led you to become a nurse?
Honestly, I was looking at a list of jobs. I probably printed off a list off of Google of all the different careers that I could go to. And I remember just not being interested in absolutely any of them. It's like, the Grinch, what was it when he's like,
oh, the clothes.
Hate,
triple
loathe.
hate.
Yeah, something like that. Yeah. It was kind of like that. But then when I saw nursing, I was like,
yeah,
I could maybe see that. And then, so it was kind of that idea first, that's what caused me to first look into it. And then, actually, the person that inspired me more to become a nurse was my aunt. My Aunt Becky, she was a nurse. And then also my grandma was a nurse before.
Oh, cool.
So we're kind of like 3 generations of nurses.
Yeah.
But, specifically my Aunt Becky, she's just the absolute sweetest, down to earth, best person that I know, honestly. And so I thought if that type of person can do that type of job, love it, and be really good at what they do, then maybe that's a path that I can follow in. So that was kind of my main inspiration with becoming a nurse.
Oh, that's so nice.
Yeah.
3 generations as well.
Really?
My mom and then my grandma as well. So I'm like,
oh, that's fun
cute.
to have your mom. You can ask questions and
or like
chit chat about stuff.
When you're upset, you can call them and be like,
they understand.
Yeah, I don't have to go on for like 30 minutes trying to get like one point across. They get it. And it's nice. I really like it.
Yeah.
I fought it for a while though, I will say.
Really?
I tried to do something completely different and I didn't feel it. So I finally got a second degree in nursing. And so I did fight it. I was like, I don't want to do it just because they do it, like whatever. I want to do my own thing.
Yeah.
And then I learned the hard lesson of just like, you're meant to do this, just do it.
What was your first degree?
Health sciences. I was going to be a physical therapist. I did all of the prerequisites and all the shadow hours. I did everything for it. And then nothing bored me more.
Really?
Oh my God. I kept going to the physical therapy office and every day it just felt, physical therapy is important. This is no slight to them, but it just felt like the environment was just like, oh my God, I can't do this every day, Monday through Friday. I need something a little bit more like fast paced. So I had a mental breakdown and I was like, I can't do it. So I kind of made a quick switch where you can do that like accelerated second bachelor's degree. I don't know if you've ever heard of that, but it's kind of like a bridge where, I've already had all my prereqs.
I'm
saying like that, yeah.
Well, sure, words are hard.
I already had all my prereqs, so all I had to do was take just those very specific nursing classes, so it went very fast. And that's what I chose to do, but anyway. So I wanted to ask, and this seems like a silly question because I feel like no one really wants this, but what really drew you to Med-Surg?
You're so right. It's just, it found me. I did not find it. Yeah, I don't know that I was really drawn. Well, I do think, kind of like you said with the, not necessarily the fast-paced thing, but I wanted to learn as much as I could, not necessarily in a short amount of time, but I just wanted to be a really well-rounded nurse. I remember when I first got into nursing school, I actually thought maybe I wanted to do the NICU. And then I learned that I was probably not cut out for that. It takes a very special type of person, and I just don't know that I ever felt ready for that. But I also knew that, you had to learn so much about kind of one specific area.
Yes.
With Med-Surg, I knew that I could learn a lot and take care of all different types of patients and do, I don't know, I just felt like the world was my oyster at that time. So that's kind of why I chose Med-Surg. And, I'd always been in a floating position, so that kind of fed into that. I just liked the change and doing something different all the time. So I don't know, they just kind of go hand in hand.
Yeah, it is a really, really good insight to work on Med-Surg. Because, I mean, you just see anything.
Oh,
anything goes.
Everything. Yes.
Yeah. So, I mean, you probably could be in many different scenarios or units and feel actually very comfortable because you're not so specific on one area.
Exactly. It makes it easy to float. I feel like, it really doesn't change that much for me day to day because no matter what, I'm going to have, completely different sets of patients and all different kinds of things going on with those patients. And so floating, it doesn't seem as scary in Med-Surg, for me at least. I don't think so.
Yeah, whenever I was working Med-Surg, I would get floated to other units and it would be like orthopedics or, transplant and all these things. And it was like, it's really not that bad. I feel like I understand what's happening. I mean, there might be a few little changes, but overall, I really felt like I grasped what was going on. So it was like, actually, I think this was a good thing.
Yeah. And you learn so much. I always say, I know a little bit more now, but a little bit about a lot. You don't know a lot about any one thing. And that's the great thing about when you go to some of these floors. Let's say it's like, a surgical floor or GI or something. Those nurses that have worked there for a really long time, they're extremely knowledgeable in that. And so if I have a question, I can ask them and I just learned so much. So, but that's awesome. Generally they all fall under the same scope and it really doesn't feel that different, day to day.
On the Med-Surg floor, what challenges did you have early on?
We kind of talked earlier about how it was being young and working with your coworkers, but also with the patients, it was a little bit difficult because you walk in and you're 20 and, even if you were 30, I'm sure that you just look so much younger to some of these patients and that, nursing has to be a very trusting profession. You have to be able to trust someone to, be able to work on your body and do things and take care of you. And so when you see someone that comes in and looks extremely young, they're like, do you know what you're doing? And I never got any hate per se, but I definitely got tested, they asked me questions, you know what you're doing? And, just some conversation goes a really long way. Just, teaching them and letting them know that, I do know what I'm talking about and, you can trust me and it's okay. Even if I look, very young, I can still take care of you.
Oh, yeah.
So, yeah.
I can see that. I feel like a large number is geriatrics. So of course they're going to be like, who is this little 18-year-old, 28-year-old looking lady trying to move me around, tell me what to do.
But one thing I have learned too is it's probably, differs depending on the area that you're in. But I feel like a lot of nurses, when they first graduate nursing school, they go and they work bedside. They go into the hospital. And so, of course, there's going to be a ton of really young nurses. And then after a while, they kind of, do something different, maybe go and get a soft nursing job or something. So I do feel like, the hospitals sometimes have a lot of young nurses. So that's not something that's necessarily abnormal. But
yeah. Of course. I can't wait for that cushy job.
I know, right? Like, I'm working my way there. I'm going up the ladder.
So working on Med-Surg, you probably collected a lot of memories, a lot of just what on earth was that?
Yes.
Would you like to share any stories that you may have acquired?
Every day there's a story, I feel like. But when you have so many things happening, so many crazy things happening, it's hard to pick one idea because you're like, I could come up with a story for every single day. And the average person would be like, what? That's absolutely crazy. So especially if you're talking to other nurses, it's kind of hard to pick an exact one. I think Ooh, I have a story about one of the first hospitals that I worked at. So I would say it was probably my second year of nursing. So I was still very, new baby nurse. I guess you still are at 2 years, right? Yeah.
Yeah.
And I was working night shift, and it was probably like 2 a.m. or so. I was in one of my patients' rooms, about to pass some meds. And I'm looking at the computer screen, and out of nowhere, the screen just goes black. And it pops up, run, hide, fight on it.
Oh.
And I'm like, excuse me? Like, I beg your pardon? Like, okay, someone's playing a joke on me, obviously.
Yeah.
Like, these nurses, like, we were all, having a good time, making jokes. Like, obviously, someone's joking with me, but, like, I've never seen this before. What are they even talking about? And so, of course, the patient's like, is everything okay? And I'm like, I think so.
Yeah.
Let me hold on one second. I'm going to just go check on one thing. And so I go out there, and all the nurses are huddled up, and they said that they received a text that there was an active shooter in the building, and that's all that they know. They don't have any information, and basically that we're going on lockdown. And so, of course, I'm like, okay, here we go. Now, sadly, I think hospitals nowadays do a little bit more education on this, but at the time, I don't remember ever receiving any kind of education, like any type of classes on what you do, which is why when those words popped up, I'm like, what is happening? I've never seen this before. And so basically we just shut down the unit. We closed the doors. We went and, closed all the patients' doors. Pretty much turned off the lights. Like, we're like, this is crazy. I don't know what's happening.
Yeah.
We went into a locked room, turned off the lights, and just hid until we knew what was going on. And so then, after a while, it wasn't too long, but of course, it feels like a really long time when you're hiding, in the darkness at work, and you're like, I'm thinking, do I text my man? Like, is this the end? Oh, that's just all the thoughts get into your head. But essentially, we got the text that, it was all clear, and come to find out, it wasn't really that bad. It was a altercation that happened outside the hospital, and they injured somebody, and then they brought it. That person was coming into the hospital to get some help, but the whole crew came into the hospital, and then a shooting occurred within the hospital, within the group. And so, of course, when security has to get involved, it becomes, a whole issue, and they want to make sure that that person doesn't, proceed further into the hospital. The scary thing was that they were right kind of at the entrance of the hospital, and there was a escalator right there, and it went right up to the unit that I was on. So had they proceeded, they probably would have came to the unit where I was. So they say that I guess, if that were to happen, it's kind of every man for himself. And they don't say on the screen, leave your patients, only care for yourself. But that's kind of what they're saying. Like, if you have to run. If they're coming after you, if you have to hide. And if it comes absolutely down to it, fight your way out of it, that you can live. So yeah, that's pretty much what they were saying. That was like the code to the whole hospital that was, but they had never taught us that. And now, it's a thing.
It's really different.
Yeah. Other hospital systems that I've gone to, I've, gone through training for that. And I'm like, well, I already know. But so really it wasn't, it didn't turn out to be that big of a deal, but it definitely could have been. And I have heard some horror stories of other nurses in other areas that go through those situations, and people that actually get hurt, and it's really sad. I mean, that could technically happen at any job. It's not something that's just isolated to hospitals or nursing, but there's a lot of emotion that gets tied up at the hospital as well, and sometimes certain things can be drawn out of people, and certain situations can get out of hand because things are really tough. So I don't know, but
that would have been terrifying.
I know. Yeah.
What did it say? Run what?
Run, hide, fight.
That seems like the last thing that I would expect them to say.
I know.
Find cover. Like something that's a little bit more like.
Yeah, I know. That's why I thought someone was playing a joke on me. It almost didn't seem real. But also, you feel a little helpless because it's not like your patient's doors have locks on them, obviously, for safety reasons. Well, for those safety reasons, but, they're going to be safer probably just in their rooms. But I felt a little like I can't like go tell my patients what's going on or they're going to freak out. I just need them to stay in their room and, have the door closed. And I remember the unit that I was on at that time had a lot of younger people on it. And so they weren't necessarily people who were just confined to a bed and couldn't get up. They could. And so they're like, what's going on? Why is my nurse closing my door at 3 a.m.? You know what I mean?
They're probably like, do you need us to fight? No.
Yeah. Yeah, I'll fight.
There's probably like a couple patients where you're like, I might ask them for their, no.
Yeah. I'm not at my 100% healthiest, but I could still fight a man. So like I said, there's so many crazy stories probably, but it's hard to remember all of them. So I'll say one that happened last week because that's what comes first to mind. I had a patient who barricaded herself in the room, and it was just a whole frenzy, quarter of the hospital there trying to get her out so that we could take care of her. So, she had surgery that day and felt really bad for her. I think the anesthesia didn't bode well for her. But when I first went in to greet her, she seemed fine. Like she seemed normal. She actually was up moving around, doing her own thing. I was like, wow, post-surgery, good. You need to get your walking in. Just be careful of your incision, and she was doing pretty well. She didn't, she was oriented, able to answer all the orientation questions that I asked, all my endless questions, what's your name? What's your birthday? Where are you? All that kind of stuff. So then partway through the night, my first clue to something was a little bit off was that I went in to check on her and she had pulled her IV out and the fluids were running on the floor. Well, are you okay? What's going on here? And she still was able to talk to me normally and seemed like she was okay. So I thought maybe it was just, she fell asleep, accidentally it came out and, so I went and gathered the supplies, got her a new IV, sent her back to bed. She was fine, supposedly. And then, lab comes around that 4 a.m. time and wakes everybody up, pokes them so we can get the labs in time before the doctor's around. So they come in and get some blood from her. And then that just set off the whole series of events. So she's just super confused, doesn't remember who I was. I'm going in there, I'm talking really sweetly, trying to, say, oh, you're at the hospital, you had the surgery. And she does not want to hear it. She's really scared of who I am, what I'm trying to do to her. I think probably getting poked, and getting some blood. She's like, what's next? Who else is going to be doing something to me? And so, she started just closing the door and pushing against the door. And I was trying to come in and, open up and talk to her. And she was getting upset and it was, getting worse. She started slamming the door in my face. So I get the help of a couple other nurses around me and we're, okay, maybe it's me. Maybe she needs to talk to someone else. We tried to de-escalate the situation as best we could. And then she started moving things over in front of the door. We heard her, moving the big trash can. We heard her moving the linen bags.
Oh my God.
The IV pole, anything she could find. And we, obviously there's no locks on the doors, but, we're trying to get in. And the blinds where we can flip it, to be able to see them. So I still remember flipping the blinds and her looking at me and then the blinds just going back. She was twisting it on her own.
Oh my God.
And then she's also has all this. So at that time I see all this equipment up against the door and I'm like, oh my gosh, we're actually getting into a situation here. I might not be able to talk her down from this. So, so she's doing that. She starts, sitting with her back against the door as well. I call my charge nurse over. He wasn't able to get in either. So, we called the house supervisor. She wasn't able to talk her down. Like we tried all these different things because I was like, I really don't want to have to call security. I feel like that's going to be really scary. And, but ultimately that's what we had to do. And he came in and he just shoved the door open and pretty much got in her face and was like, you sit down, get back in bed. And she's like, oh my God, what is happening?
Oh my God.
And goes back and sits down and pretty much got scared out of her and it set her straight. It took a little while. She didn't know what was going on and we had to, explain everything a few times over. I eventually was able to get her family on the phone and that always helps, when they're able to tell them and be able to hear from someone. But yeah, so it's not that crazy, but that just happened last week. So it's just stuff like that happens all the time. It's
How long do you think that took to kind of fix the situation? Because that was at 4 a.m. Did you get her at least settled before shift change?
Yes, I did. Good. She was settled. She was still confused, but she was, doing much better. She, definitely before shift change. It probably took like a couple hours, I'd say, the whole ordeal. But I'm really glad we didn't have to, proceed to the next step, which would be any kind of medications or any restraints. I was like, that's just going to make things so much worse.
Oh, yeah.
And I really don't want to go there. And she's a really sweet person. I mean, she didn't mean anything bad by it. I think she's just really scared and her brain's not working right with everything going on. So,
poor lady.
I know.
I wonder if she even remembers it.
Probably not. No.
Can you imagine causing that much of a ruckus?
Yeah, well, because I met her, when she wasn't in that state, and she wasn't like that at all. She was very nice. And so, the same goes with dementia patients. They
absolutely.
say that they're just the sweetest, nicest person. And, just the other day, too, I had a patient who she was probably like 100, 95 maybe, but she was so sweet. We were, chit-chatting about the book she was reading, and I said, oh, I got to read that book. I've heard good things about it. She's like, oh, honey, I'll give you the book. I don't even need it. And I was like, no, that's very sweet, but I don't take anything from patients there. But then nighttime came, and everything changed. She, didn't remember me. And so it was, what are you doing? Get out of my room. What's happening? And I'm like, oh, don't you remember me?
Doesn't it kind of hurt your feelings?
Yes.
I can only imagine how family feels.
Obviously way worse for family.
Of course.
If I bond with a patient, ultimately I'm going to leave 12 hours later and probably never see them again, especially because I float from floor to floor, so I don't have the same patients back the next night. But yeah, when your family member is like that, and if they don't remember you, that, and they're the one that raised you and, might have been the closest person to you your whole life, that would be extremely hard. And I'm sure nobody really knows what that's like until they go through it themselves. We can sympathize with, these people because we understand a little bit of what it's like, but, we'll never fully understand unless you go through that situation yourself. So,
yeah. I think it's like one of the worst things that can happen to someone. Yeah. It's like a slow, just slow for everyone burn. Around you really is. Yeah. So anyway.
And it's different to everybody. Some people it's, gets bad really fast. Some people it takes a little while. Some people are just pleasantly confused and they're the sweetest, all the way through. And I've always wondered what makes that happen? Like, why are, some people super horrible and obviously they can't control that. And then some people are super sweet. Like, is that something that's deep down in you that's coming out? Or is it just something that...
Or is it just brain chemistry or parts of the brain that are affected more than the others? It's like, who...
Probably that, because, it's usually someone that's really a nice person and it can affect them bad. So it's very sad disease.
Yeah. So I wanted to ask, I know now you, for a couple of years, you've been on the float pool team. Mm-hmm. How do you like that?
So I do like it. Every nursing position I've ever had has been a float position. I've never had my own team on one unit. I've always been a float. So I guess I don't really know what else to compare it to. I've just always floated. My very first position was kind of a unique position. Now that I've talked to some other nurses, maybe it's common, but I haven't really heard about it, outside of the job that I had, but it was called the acute care rotation. And so I would start, I was at one hospital, but I would start on one unit and I would be there for a month. And then the next month I'd move to a new unit. So I didn't have to float every single day. It was, I was able to get my grounds a little bit as a new grad and being able to figure out what I was doing as a nurse, ask questions, build, relationships with the staff there. And then I'd move on to the next unit after a little while. So I did that probably for about a year. And then I moved to the float position within the hospital and I was floating every shift. But I knew the hospital pretty well at that point. And then from there, I did a little bit of travel nursing. And then now I have kind of like a local travel nurse position where I float to different hospitals within the area. And then I float to pretty much all the Med-Surg tele floors within those hospitals. So yeah, I've been to a lot of different places. There was one time I tried to like add up every single unit that I've been to try to get a number, and I just lost count. I couldn't. It's been so many.
If you had to
different
guess, would it be at least 100?
Probably, yeah. Yeah, that would probably be around my guess. I mean,
my
give or
goodness.
take. I could be way off, but yeah, probably about that amount.
So with that experience going to so many different units, if you had to pick something to maybe get a permanent position in, which I don't foresee you doing anytime soon, but what would be like your favorites?
You know, I always say that if I had a true favorite, I'd probably be working there right now. And that's kind of when I first got the job, or I left the other travel nurse position and I came here to what I'm doing now. I wanted to kind of get a lay of the land and see all the different hospitals, and I was like, I'll pick a unit after going around and seeing all of them, and then I never did. I would just keep doing what I'm doing, and I like doing that. I think more importantly than the type of floor would be the teams that are on each unit. There's certain, everywhere you go to work, you're going to love some people you work with, and, maybe
not the others.
with some other people. But
yeah.
I think that my favorite units are the ones where I, respect the teams that are there and the way they work together and the way they allow float nurse to just fit right in with them. Mm-hmm. Those are ultimately my favorite. So, yeah.
It's about the people, not the place.
Yes, exactly. Mm-hmm.
That's sweet. So you mentioned that you did some travel nursing. Where did you go?
I went to South Carolina. I did one travel nurse position there before I, entered into this local travel nurse position that I have now. But yeah, Greenville, South Carolina is where I was at.
Did you enjoy it?
I really did enjoy it. Yeah, I think I had a really great experience. I know people that travel, you're going to get a little mix of everything, probably, especially if you're moving around every 3 months and going somewhere new. You're going to have all different kinds of experiences. But I had a really great experience. I loved the people that I worked with. They were so sweet. Everybody had a Southern accent there. And then I come in and I'm like, hi, I'm Kayla. I do not have a cute Southern accent. I'm sorry. But everybody there was, very sweet, very helpful, very grateful that I was there, which, you probably don't get that. I know you don't get that everywhere. Yeah. You get some people hating on you because you might be making a little bit more than them. And like, who do you think you are coming in here and, doing the same thing I'm doing, but making a little bit more money. So yeah, I had a great experience. I would do it again, in a heartbeat if my personal life, allowed for it. But
did your husband come with you?
No. So no, he was in Florida, and that was a big part as to why it was tough for me. But working as a nurse, you can work 3 shifts and then you can have 4 or more off. And so I would work my 3 shifts and then I would just drive down and see him.
Oh, yeah.
I do feel like I got a good piece of South Carolina while I was in there, but my heart was definitely in Florida at the time.
Yeah.
So, I probably could have got a little bit more out of it. But I still saw, Greenville is beautiful. I really love the area. I love the hospital that I was at. I do feel like I learned a lot too, because I had just been doing nursing a little over 2 years at that point. Mm-hmm. And then, they always say before you travel, get at least 2 years under your belt. At least that's what it always used to be, just to kind of make sure you have, some more knowledge.
Most of your questions asked.
Yeah, you know what you're doing as a nurse, kind of. So yeah, I was on a respiratory floor, and I remember going there, and it was patients, with trachs and
oh goodness,
all kinds of stuff, anything respiratory you can think of. And I also had a couple of patients that were on ventilators, and I remember thinking, do you not have to be in the ICU to get a ventilator? Yeah. Like, what is happening here?
Was it a step down, or was it like?
Yeah, it was a step down.
Okay.
So, so that part was, scary for me being new to that, but pretty much respiratory managed all of it.
But they allowed you to care for vented patients, even though you didn't really have any experience.
Mm-hmm. They were stable vented patients, so
still, I mean, you
I
kind of have to have that basic knowledge of like if something's happening, like just looking at the machine or looking at the, you know, cords or, you know, tubing and all of that and being like, I've been here before, what's going wrong or whatever. That's scary.
I know, it was scary. I did feel confident though in the staff that was around me.
Okay, good.
If I ever felt like something wasn't right or had any questions about anything, they were very quick to come in and help me. And so, I think if they weren't accepting of me with that, that would have been really unsafe for the patient if I didn't know what I was doing.
Send me somewhere else.
Yeah, I'm calling respiratory every 5 seconds. Like, the machine's making this noise. Can you come and check it out?
I can't imagine if like I'm in a new place, all this stuff, and then I go and I have a vented patient and I've never had one before. I would freak out. But good for you. You handled it. You handled it
well.
I
remember my first day starting there. I couldn't even get into the system, and they're wanting me to, you know, start off, you know, hot and pass meds, and I'm like, that was an issue at the very beginning because they were wanting me to pass meds that someone else had pulled and doing all these things, and I'm like,
Nope.
I'm not going to give anything that I did not, you know, pull under my own name and, you know, be able to scan to the patient because I'm not about to give the wrong med to the wrong patient.
And that's why you wait 2 years, because if had you 20 years old or however, you know, 21 at 6 months into nursing, you had made that move and traveled, you may have been like,
you think that's normal. That's just what they do.
Sure.
Yeah.
Like, no, you kind of get your whereabouts and you're like, actually, nope, I'm not doing this, this, and this because I'm not going to lose my license for you. And it takes a second to kind of get that like oomph about you where you're like ready to speak up and have confidence and kind of like pick and choose what you're willing and not willing to do.
Well, you definitely have to stand up for yourself as a nurse in general, but especially as a float or travel nurse, you have to be able to stand up for yourself.
At least from what I've seen, they'll give, even on units I've worked on, you know, they'll give a travel nurse an assignment where it's like someone here would say, I'm not taking that.
Yeah.
They try to take, you know, advantage of the situation. So you really gotta know what you're doing before you go out there and kind of just take what people give you.
And I try to not look at it that way. There are some travel, or not necessarily travel nurses, but nurses that are in my position that, you know, are kind of negative and just think that everywhere they go, that they're getting the worst assignment, that they have the worst set of patients. And, you know, honestly, I'm like, everybody has some rough times. Like, we're all in it together. We're all hurting, you know, drowning here, but we're all, you know, lifting each other up at the same time. So I never see it as, you know, that they're singling me out at all. I do think sometimes if certain patients are on one unit for a really long time, they try to give their staff a break, especially if it is, I don't know, someone that has, I don't know, maybe they're not the sickest patient, but maybe mentally they have some stuff going on.
Hard to deal with.
Yeah, exactly. And I do get that, because if I were on a floor and I was repeatedly getting a patient that was extremely trying time and time again, I would want a break too.
Oh, yeah.
But sometimes, you know, you work back to back to back and it feels like you are getting those patients sometimes. But, you know, you just keep your chin up and do your job, take care of your patients, and then you can go home and forget all about it. That's kind of the beauty of, you know, floating is it's a clean slate every day.
Yeah. And I think it's also a positive way to go about it is like, I can do anything for 12 hours. Exactly. I've told myself that a couple of times. I'm like, it's okay. I can do this for 12 hours and then I get to go home. Yeah. Like, so it's all gonna be good.
Which in the moment though, you're like 12 hours. It's so long.
I know. Honestly,
it's a whole day later.
when I hit like that 1 o'clock, which is like literally the middle of your shift, I'm like, oh, I can do this. And then I hit 4 o'clock and I'm like, oh, that wasn't that bad. You know, like
I got a little bit longer.
I got a little bit longer. I can do it. Yeah.
That's why I always take my break towards the end of my shift, so that then I can get as much stuff, done at the beginning, and then not that there's ever a lull, but kind of, because I work night shift at that like 3 or 4 a.m. Sometimes it can be hard to get past that point. So I'll go take my break at that point, and then I can tell myself, well, it's just a few more hours after this. It's easy, But if I were to go take my break probably earlier in the evening, I'd be like, oh, I got an entire shift I still have to do after this. But
is that 3 a.m., 4 a.m. time the hardest for you?
Working honestly, night shift? No. I think the hardest time is right when that 7 a.m. hits and you have to give report, because I'm good. I am good. And then all of a sudden I have to give report and I'm like, wait, what? I promise sense. I know. Yes, I know what I'm talking about. I know these patients, but I'm stumbling over my words, but I'm just tired. I got to go home. So that's usually at that time, that's probably the worst for me.
I remember I did nights for like only a year. It was horrible. I hated it.
Oh, really?
Oh my God. I hated nights. It's
different
ruined,
for everyone.
Yeah. I feel like it ruined so much of my personal life that I just didn't care about the extra pay. I was just like, get me out of here. But yeah, no, I would start going cross-eyed at like 3, 4 a.m. I'd have to do like laps around and like, I'm like, oh my God. And then, yeah, there were a couple times where like I would call people and be like, talk to me on the phone. Because even during report, my eyes are going cross. I'm like, I promise I'm not insane and I know what I'm talking about, but like my words aren't even forming anymore.
Yeah.
Yeah. So.
Which is kind of scary if you think about it. I mean, I've never felt like I'm so sleep deprived that I don't know what I'm doing. But I mean, we're human. Mistakes can be made very easily. And it's, I don't know. I do like the 12-hour shifts. I guess I don't know any differently, but I definitely wouldn't want to do 5 days a week, 8-hour shifts. I feel like maybe, is it 12s? 4 12s? Is that
4 10s?
4 10s, yes. 4 12s. Like, wait.
So now that you're working nights, do you have a preference? Like, do you really enjoy nights or is it more like a financial thing?
No, I like nights. Yeah, I started out nights when I first became a nurse, and then I did days for a few years, and then I switched back to nights. The reason why I switched back to nights was because I'm PRN in the position that I'm in, and I was starting to get canceled a little more often and not getting as many shifts as I wanted, because I work full time, even though I'm technically PRN. So, I knew that there were some more positions available on nights, and so that's why I made the switch back. And now that I'm back, I really do love it. I just like the vibe of night shift better. I like the people.
Oh my God, the vibe is so much better. Yeah.
People aren't stuck up, bossy. Like, I don't know. It's just, it's a chiller vibe. I feel like I can connect with my patients a little bit more because not so many things are going on at once. They're not running to this test and that test and this doctor's coming in, and, a little bit of that still happens. But I think that, I don't know. I just like that kind of nursing a little bit better for me.
Yeah, I do feel like there's like so much less interruptions during the night. Like I remember on the Med-Surg floor during a day shift, I kid you not, it sounds like I'm exaggerating, but between like MRI, X-ray, lab, a doctor or a family member, whoever it is, I would get like 40, 60 calls a day.
Oh, yeah.
A shift. Easy.
You can't do one thing without getting interrupted.
Yeah, and then
that's
night
totally
shift, I would have shifts where I didn't receive one single phone call, not one.
Yeah, I'll like jump if I get a phone call.
Yeah,
who's calling me? What is happening?
In the middle of the night, how rude. No,
exactly.
I just remember that vast difference of being like, really, like, honestly, that's almost worth it.
Yeah.
It affected me so much sleep-wise that it wasn't worth it, but it was almost to that point where I was like, wow, like, this is nice.
My brain is definitely calmer on night shift. I would get home after, a shift on days and my brain was just completely, I was just done, because so many things had been going on. And not only do you get so many calls, but I feel like the calls you get sometimes are just, you're just the middleman. It's someone that needs to get a hold of someone else. Oh, can you tell the doctor this? I'm like, well, no. You can pick up a phone and you could call them. Why don't you tell them? Because, it's you're going to be able to get the information to them, faster. Why are you calling me? But that, the nurse is kind of the middle point for all of that.
For every single thing. And yes, I would get so annoyed when doctors would reach out, like a specialty would reach out to the hospitalist, or the hospitalist would be like, oh, can you ask X, Y, and Z, or call them and ask them this? I'm like, you guys are going to have a full-blown conversation about this that I play no part in. And to be honest, I have a 20 million things I have to do right now. So I would just, I don't know if you've ever used Epic, but I would start like one of those conversations and I would be like, this person would like to speak to you in regards to blah, blah, blah. Here's the phone number. And I would just go do whatever I had
really
to do.
Smart.
Because I'm like, I'm not doing this.
Yeah.
Because you guys are going to have a conversation that goes well above my head. I'm not going to understand what you're saying. And then at the end of the day, you're not going to ask me what my opinion is anyway. I don't need to like do all of this for you.
Yeah.
Be adults, call each other.
Exactly. Yeah. What if you have a question? And then I'm like, wait, hold on. Let me call him back.
Like, you think we have time for that?
No. No, absolutely not. And I know they're busy too, but it's just a different kind of busy. You know what I mean? We're hands-on.
Yeah, like I'm literally wiping butt.
Yeah.
Can you call him?
You have your hand on the phone, a clean hand, mind you.
Yeah, because I had a Vault phone, so just a regular cell phone, like like an iPhone. But now, in the unit I work in, I have a Vocera, which is, I can say, "Hey, Vocera," and it just call blah blah blah, and it calls them. But before, you could be like in an isolation room, again, dirty gloves, and someone's calling you every 5 seconds. It was just. I don't miss Med-Surg at all. I can go on for days about how much I hate it. So, assuming because you started at 20 that you were already a nurse way prior to COVID.
Yes.
I want to ask kind of what that jump was like, because you had a good insight what it was beforehand, and which I don't.
Yeah.
How did that feel, especially in the beginning? Was it just like a crazy experience for you?
Of course, at first, everything's a little bit scary. It was definitely the unknown. What's going to happen? How is this going to affect my job? What's this going to look like in the future? Are people going to be going down left and right? Are we going to be, are we going to have the resources we need? All of that went through my brain initially, and that was very scary. But I don't have any great, I don't know. I have to be careful with how I word this, because I feel like the people that it affected really hard ended up leaving. They aren't there anymore, and maybe bedside wasn't right for them. Or maybe it was. It's just, it was a very traumatic thing that happened, and we don't know how it's going to affect us until we're in it. But for me, I really didn't see a major change in my day-to-day. Being a float nurse, I actually did float to a lot of the COVID units. And, I just kind of saw it as the same. I'm coming in, I'm taking care of someone that's sick. They need me. I'm going to do my job. I'm going to take care of them the best that I can. And then I'm going to go home and I'm going to continue living my life. Yeah. And so that's kind of what I did. I think probably the biggest challenge was feeling like we didn't have all the resources that we were supposed to have. But that was also the whole country. Nation. Yeah. So, I can't expect to have a brand new mask every time I go in. But before COVID, I remember when I'd have patients and I would need to wear the mask, and I would get a brand new one every single time I went into the room, and we'd just toss them. Like, that's just what people did. And then, COVID happened, and, there was a shortage of a lot of things, and we had to consolidate. And I still got a new mask every shift because I was a float nurse and I'd go to a different area every time. But I remember there was staff nurses that had to keep the same mask. They'd put it in like a piece of Tupperware or a brown bag, and they'd just keep putting that thing on. All the germs are on the outside.
So gross.
You put it in the bag, you shake it up, and then you put it back on your face. And that was kind of crazy to me. But
I mean, yeah, but if you don't have anything to put on your face, it's kind of like, which one do you pick?
Exactly.
That's so gross.
Yeah. At least I wasn't wearing a trash bag, Do you see those photos?
Oh my God. Oh my God. Or like just the people out in the general public that were like wearing underwear on their face.
Oh my
like
gosh,
boxers,
yes.
like in Walmart.
Yes. And then the next person probably had a huge stack of masks back at home, and that's what we didn't have.
I know, yeah.
It's just people for you.
Yeah. Yeah, definitely graduating in the middle of COVID, getting my NCLEX, and then starting the next day after that. Really, COVID was all I knew.
Yeah.
Until like now it's of course fizzled out, and I'm kind of getting like what is actually nursing. But like, working at the hospital that I work at, we would be in black status. I mean, every single day, every single shift, there'd be times where it's like patient in the hallways and all this stuff, and you'd have 7 patients when you're really only supposed to have 6, and like, sorry, there's nothing we can do about it because everyone left to travel. Yep. Because of course,
because money was good.
Yeah, because our state is one of the lowest paying.
Yeah.
So they would go up to, and I don't blame them. I never felt any type of way about it because I'm like, go get your money.
Get your money. Yep,
yeah,
exactly.
Absolutely. I'm like, bye. We'll figure it out over here. If I wasn't such a brand new nurse, I most likely would have done the same thing. And there were times where I was really close to leaving and going and making some money, but I'm like, I've only been here for 4 months. I think I could wing it. No, I'm glad I didn't. But I just remember like just being like, oh my God, is this nursing? Like 7 patients.
Oh my God.
But everyone would say, this isn't what it normally is. This is just COVID. Like this, before COVID, it wasn't like this. Like it's so much better, blah, blah, blah. So I kept holding on to that. And really, I didn't wait on the Med-Surg floor to see that change because I had switched to, the unit I'm on now. And so I can't really compare it because I was in it and I was still in it when I left. And then I don't know. Like I have no insight of like, is it any different?
Well, no wonder you hate it. You're there during a global pandemic.
Yeah,
it's crazy.
So I don't know anything else.
Yeah.
COVID was just nuts. Did you ever do it like any of the like side jobs where it was just like vaccines, monoclonal antibodies, any of that?
I didn't. I kind of regret that. I wish I would have because you could have made a lot of money doing that too. And it was probably a pretty chill job. But no, I never, no.
No. Okay. No. So I started on Med-Surg and I started making $30 and some odd change on the Med-Surg unit with 6-7 patients getting my butt handed to me. At the same time, I was working on the Med-Surg unit. I got a job doing COVID testing. It was $50 an hour in comparison to what I was making. I'm like, oh my God. And then they had unlimited overtime. I worked 9 12-hour shifts in a row.
Oh my God.
One time. Because it was just like for the first time in my life, I mean, I had just graduated as a nurse. I had like unlimited money, it felt like. I was like, oh my God, I'm rich. No? Yeah, so COVID was just such a whirlwind because I didn't have any self-control. I was new. And then, of course, all the outside, oh my God, COVID, all these people are, passing away and, you need to get vaccinated and then trying to decide, should I get vaccinated? Should I not? And then, the hospital's coming down and being like, you have to be vaccinated to work here. Did they try that with you?
They did.
Yeah, they tried that with us too.
But they backtracked. Last minute.
Very last minute.
Which was interesting,
it was.
I'm like, was that all I don't know. Who knows?
Who knows? People probably have very different opinions.
Oh, yeah. Do you feel like you were prepared well enough for your first job because you didn't have those clinicals or as many clinicals? No. You were scared?
Oh my God, it was horrible because again, like I said, I've never been an MA, a PCT, no nothing, CNA, nothing. Yeah. So I had such little experience. And then I go in to this full-blown Med-Surg unit and they're like, we're getting ready for an admission and, people are passing you things like, I haven't even like hooked up the suction to the wall. Yeah. Like little things like that where you feel like an idiot, but like if someone doesn't, you only need to see something like that once, but you need to see it once. At least for me, I'm not going to go in there and be like trying to connect everything and just stand there like an idiot. So there was such a large amount of information to learn at once. I cried so many times. I was like, this is so much. And it was just, and then you add on like getting to feel comfortable with patients, getting comfortable to give medications and all while you're just trying to learn the basics because you didn't even really go to clinicals. It's crazy. Like COVID was just like.
Yeah, that is crazy. And you also have to have, I always say, a healthy dose of anxiety when you're a nurse because something could go wrong at any minute. And if you just slack off and don't think about that, then, you won't be prepared when something bad happens. Yes. But that really adds to the stress of nursing because you're always heightened to, is everyone good? Is everything okay? What could happen? Am I prepared? Do I have all my stuff?
But I think that makes a really good nurse because I know people who are like that and people who aren't. And the people who aren't, I'm like,
yeah. Yeah.
I'm thinking of some people, but no, but it's like, you're so confident and you shouldn't be. Yeah. Anything really could happen. And the people who are like playing games in the back and half their patients are calling and they don't even know because they're just like, who cares? That's insane to me.
Yeah.
Like I will go a whole shift without peeing if it means that I'm doing everything I'm supposed to do and I'm on my P's and Q's and all that stuff. So different personalities. I guess they show up in every field, but it's kind of crazy to see it in the nursing field because I'm like, these are patients' lives.
Yes, that's the thing that's very high stress. My husband and I talk about things and he always is very sweet. He tries to, be on the same not same level, but he tries to feel like he understands me. And so he'll compare my job to some of his past jobs but it's not that, there aren't people's lives in your hands. And so I'm always like, yeah, but imagine all that. And then you have to worry about someone dying or, something like that's crazy.
And it's your license.
Yeah, exactly. Something happens there, you make a mistake, somebody dies. Like, that's not,
It's not like, oh no, whatever. Someone's mad and sends like a mean email. Like,
yeah,
it's like,
exactly.
Yeah. It sounds mean, like we're like making fun of them, but like it really is such a vast difference. I wanted to ask like what your ick is. Like everyone has something that like just grosses them out the most, whether it's like a trach, poop, vomit. Like what is your ick?
Yeah, respiratory. The slime, the gunk, not necessarily trachs itself, but having to deep suction, all of that kind of stuff. Poop, fine. Throw up, fine. Whatever. Secretions, that's the word I'm looking for. Oh, those always get me. But, when you're in the moment, you don't really think much of it. You just kind of, you're at work, you're doing your job. But definitely if you were to think back on it, that's definitely my biggest ick.
That's like the one thing that can get me kind of queasy is like on the adult floor when I had a trach and it was just like copious.
Yeah.
Like I can think about it right now and get immediately nauseous. And I'm just like,
well, you got to watch where you stand too, because if they cough, like it could come out. You got to make sure you're not in the right area. Yeah. So I'm always like, keeping a little distance away because you never know what could come up.
Literally. I didn't get a lot of trachs on my unit. I only had 1 or 2 in the whole 2 years I worked there. But then I do get them a lot with babies. And of course babies aren't as bad, but every once in a while it's like, it can still throw you for a loop, like a really yellowy secretion. And you're like, ooh, or if the patient is getting sick and not only is it mucusy and thick, but it has a stench.
Oh, no.
Mask with toothpaste and then another mask
peppermint
on
oil
it.
or something.
Something like, yeah, but it's crazy because I've been in situations where there's like vomit, poop everywhere. And I'm like, it's good.
Yeah.
But a booger just throws me out.
Yeah, seriously. Although I would say there was one time I had a patient who projectile, I'm not even joking you, like turned and I'm in there with another staff member and it was like projectile. And that was one moment that I was like, I love my job.
Don't puke.
It's okay.
Don't puke.
Exactly. It's okay. It's okay.
One time I did have to actually, this was in the middle of COVID and just the way the patient was laying in the size of the poop.
Yeah.
I had to pick it up.
Yeah.
I still can't get that out of my, sensational like memory. I don't know how to explain it. But okay, so during COVID, this one meme came out and it was a nurse running down a hallway with, I don't know why. Do you remember
Girl,
what I'm
I know exactly what you're talking about. So, the bedpan with the mask.
But like, why?
I know.
I don't understand how that picture happened.
Yeah. Do you need a sample or something?
Yeah. Like did you have to take the whole thing? No, that was me in real life. So we turned this patient over and, he hadn't pooped in, it was a very long time. I don't remember the days, but I think it was over a week. And I had filled him up with lactulose all day. I bring my friend in there and she was like my buddy for the day. Every time we worked together, we were like, oh, everything's a 2-person job,
exactly.
So we were in there and we roll him over. And for some reason, I don't know if it was like the size of it. I just started to gag. It was
oh my God,
bigger than my forearm. Like just the biggest poop I'd ever seen in my life. Oh my and anyway, it was so big and heavy that the dip he was causing in the bed, it's not like we could just like quickly just roll it into the trash can. And she's like, no, you grab it. And I'm like, and I grabbed a full-blown, the biggest turd I've ever seen. And I put it in the trash can because I can't flush it. That would, water would be going all over the floor if I put that. So, I dump it in there and we clean the patient up. For years, we have always sent each other that meme. Yeah. So we always just had that inside joke together of like, remember that one time?
What job talks about this?
I know. Generally, it's like what you've seen, when you get to the point where you've wiped so many butts, you're like, what's the next one?
It doesn't matter. It doesn't faze me. No. Exactly.
No. Anyway. Yeah. So looking ahead, what kind of nursing do you see yourself doing?
Anything other than Med-Surg? No,
Literally, no.
No. If I absolutely hated Med-Surg, I would have been long gone. Obviously, it's doing fine for me now. I don't know what I want to be when I grow up. I think I've had lots of different ideas. You know, there's so many different things within nursing you can do. I think one idea I do keep coming back around to is aesthetic nursing. I'm really interested in that. The one thing holding me back right now is trying to decide if I want to go back to school or not, because in Florida you have to be a nurse practitioner in order to do or in order to inject, which I think is great. I do agree with that. If you're going to inject something in my face, I hope you know what you're doing and I hope you're educated. So, you know, I do agree with that. But at this point, I don't know if I want to go back to school. I have to really think hard about that. So I don't know. That feels a little bit out of reach. But I've always thought maybe, you know, that'd be something down the road that I would do if, you know, I've worked and I've saved up enough money and I want to go back to school later. Maybe I'll do that.
So what do you think like the pros and cons of going to school are? I've kind of always done the same teeter-totter of like, should I not? What are your pros and your cons?
Well, I think sadly money is a big con. Like I'm still paying my student loans from the, you know, my first. So it seems crazy to go into more debt just to be able to get something that I haven't even paid off yet from the, or, you know, first go around. I could just be totally naive about this, but I'm curious if there's enough about aesthetic nursing in the programs nowadays, because I'm like, why would I go back to school and learn all this stuff to essentially be a doctor's pet? Like you can do the doctor's job, you're prescribing medications, you're doing all this stuff. And then I graduate and I still feel like I don't know anything about aesthetic nursing until I go and I follow someone and, you know, gain that knowledge. So I almost, obviously it was not a waste, you know, you would learn so much, but I feel like, you know, school, you would learn so much about everything, whereas I just kind of want to focus on one avenue of nursing. So I don't know, that's kind of a struggle for me, I guess.
If there was a gap between being able to get the job you wanted and then having to just do general, you know, family medicine, would you even want to do that? Like for that period of time where you're just waiting, because it is so... It's everyone wants to do it, so it's like I know there might be a gap of time.
Yeah, I think I would have to have a little bit of knowledge or maybe follow someone in that first before I would be okay with having that gap. You know, nursing school, it really isn't that long. I mean, you get your prereqs and then it's a 2-year degree, and then, you know, you go on from there typically, unless some people do the accelerated program, which is so crazy that you do it in, you know, less than 2 years or, you know, 4 years, whatever it is. But yeah, I think that if, you know, I knew for a fact that that's what I wanted to do, then I would be okay with that gap and taking a little bit of time. But I think that not being certain, it's a little scary to go through all of that and take, you know, a few years not knowing if you're even going to enjoy the outcome. So,
yeah, one of the things I wrestle with, you know, should I do NP school? Should I not? Is I really like the idea of like, if I follow my orders and I relay the information that I should, I'm doing my job. And I don't have this overlying, like, I'm making really important decisions. And that really terrifies me. Of like, you know, of course there's a doctor over you, and, you know, there's always a person that you supposedly should feel comfortable to go ask questions if you're not 100% and all those things. But I'm like, I think that's such a big responsibility to take on. Yeah. For one, especially if you're a nurse past that like 7-8 mark, a lot of NPs graduate and make less.
Right. Which is so crazy because they do so much.
And then they have that like 2 to 3 year, you know, gap of like, okay, I'm just trying to work myself up back to what I was making as an RN, which is nuts. And then now I have even more responsibility than I did before.
Right. Yeah.
I'm not making the decisions.
That's exactly right.
So I get stuck where I'm like, do I want that responsibility? I feel like it would keep me up at night. You know, on the Med-Surg floor, you talk to so many different hospitalists and, you know, specialties and stuff. And the people that would just let things go and be like, oh, you know, this crazy blood pressure, and they're like, oh, we'll monitor it, and I'm like, that wouldn't be me. I would be like, we're gonna order X, Y, and Z, like blood cultures, and do all this stuff just to make sure that this patient is okay, when really all these people are like, oh, it's okay. Yeah, like I would be the person that's like, oh,
I know.
It would keep me up at night, I think, the responsibility. So I think it also is more like about life balance of like, what do you want? You want to take on that responsibility? I don't know.
Now that you say that, I don't know.
Oh,
Yeah, I
no,
didn't.
not to talk you out of it.
Yeah.
But because I think it's such a great thing to do. And, you know, at the end of the day, they probably do benefit from it after a little while, maybe, you know, 5 years, 10 years. They're probably like, oh my God, thank God I did that.
Yeah.
It's such a hard decision to make.
Yeah.
Yeah.
I definitely wouldn't want to do bedside or work at, you know, the only thing I think I want to do is aesthetic nursing. Unless you get, I mean, you know, when I was in nursing school, like I said, I thought I wanted to do NICU, and then I got into it and I was like, yeah, maybe not. So maybe the same thing would happen. You know, you go to school and then you know, realize while you're there that you want to do something different. But yeah, I don't know. That's why I'm kind of hard stuck on what I want to do next and why I'm kind of just sitting here for now. Cause I make okay money. You know, I'm getting new experiences every day. So I don't hate my job. You know, I don't cry going into work anymore. You know, I think when you're new, you kind of feel that way. And, you know, you still have bad days just like everybody does, but you know, it's not so bad. So I don't know. I think, you know, if it weren't aesthetic nursing, maybe I've always said maybe some kind of office job, but I worried that I'd be really bored. That's what people say.
Yeah.
Like, to go from such that high, crazy, you know, work environment to, you know, sitting there and making phone calls all day. You know, every job's different, but
yeah, you don't think you could do it.
I don't know. I don't know. I've never done that before. I think at some point my body will probably want me to do that. I think I'll start, you know, my back will start hurting, and, you know, which sometimes still does happen. And I'm like, oh, girl, I'm 28. I shouldn't be having back problems, but, you know.
Did you ever get plantar fasciitis?
No.
I got that when I was working all those shifts and
Really?
COVID. Yeah. And I was like, oh my God, I feel so old.
Yeah.
Because I was like 27, 28 when it really first started to progress. And anyway, yeah, I feel like at a certain time, like it's like your neck, your back, keep going now.
Well, no, seriously. And I'm so bad about raising the bed up every time I do anything because it's so awkward.
It is like,
hey, hold on here. So how are you doing? They're like slowly rising up. I just like do one thing and then slowly go back down.
Yeah.
But that's really what you should be doing.
Absolutely.
But you get busy and I come in and I just lean over, do my thing. Unless I'm doing something that's going to take a little bit longer or like an IV or something, you know, cleaning up a patient. Obviously, I'll always lift them up. But people always tell me, you know, you're gonna, you know, your back's gonna be hurting you someday because you don't raise the bed up. And I'm like, I know.
Does your facility have like lift teams and all of that?
The one I'm at now, no. It's just me, myself, and I.
Oh my God.
No, not really.
Yeah.
The tech. But yeah, because sometimes, you know, I've had times where I can't find anybody on the floor that at that time it's so busy. And I will invert the bed, you know, Trendelenburg, and I'll just say, go hold yourselves, and I'll just take the sheet and whoop. Usually if they're really small, I'll do that. But the patients usually are like, what is happening to you? Are you going to be able to lift me? And I'm like, girl, I got you. We're good.
Yeah.
Only if they're really small will I do that. But, you know, that's not the best for your body either, obviously, leaning over the bed and doing that. But sometimes you got to do what you got to do. You're like this.
I'm trying to get in and out of here. I have a million things to do.
Yeah.
Like 1, 2, 3, go.
This patient's uncomfortable. They need to be up higher in the bed. So it's what we got to do, you know?
Yeah. If you could go back in time and tell your younger baby nurse self, like give them any advice, what would you say?
Girl, run. No, just kidding. No, absolutely not. Absolutely not. I think I would say you need to get some thick skin fast. Quit being so naive, but you don't know until you know. I think that I was pretty naive. I think I was a pretty sheltered person in the way that I grew up. And, you know, I was just kind of shoved into the world and, you know, all the different people that you meet within the healthcare system. It was a lot at first. And so, you know, I had some moments at the beginning where I would, you know, get my feelings hurt. The patient would say something mean, but, you know, like we talked, they might have even had dementia. They didn't even know they were saying that. And that, you know, was something that I struggled with at first. And then I pretty quickly got some thick skin and thought, you know, we're good here. So I don't know. I think I'd tell my younger self that everything's going to be okay. It's not that big of a deal. You do the best you can, and just get some thick skin, I guess. Do it now.
ASAP.
Yeah. Get some calluses.
Yeah, because you will get your feelings hurt when you start.
Oh, yeah.
And even if someone or, a coworker or patient or whoever, you'll hurt your own feelings. Mm-hmm. You'll say something dumb or ask a stupid question, and then you'll beat your own self up too.
Oh, yeah.
Yeah.
Well, you worry about sometimes what other people think, or do they think that, I should not be asking that question? But,
yeah,
I always say asking questions is so important.
Yes.
Someone that doesn't ask questions, I would probably be concerned to not work with them, because obviously if I'm just there with a person for one shift, I don't expect them to ask me.
Yeah.
I'm like, you know what you're doing, you're good. But yeah, the person that never asks any questions and just, thinks that they know everything, that can be a recipe for disaster.
Yes, 100%.
Yeah.
Okay, so if someone were to come to you and say, I'm thinking about, getting into nursing, what would you say?
Ooh. Well, I guess it depends on what type of, I guess if they're brand new, they probably wouldn't know what type of nurse they want to be. But I think my number one piece of advice would be to get some experience. I would say if you want to work bedside, become a CNA, go get your foot in somewhere at a hospital, start working there, see if you like it. It's not the exact same job as a nurse, but you're going to be working hand in hand with them, and you're going to get a lot of advice from other nurses, and you're going to see firsthand if that's something that you can, see yourself doing for the long haul. So I think that that's something that, obviously only if it, is easy for you. Some people aren't able to, work prior to that. They just want to get the degree quickly and be able to start making some money. So, it's different for everyone, but yeah. And then if you know what you want to do, just go for it,
Yeah, I think it would give such good insight to what are you walking into? Because if you've never done it before, it's scary.
Yeah,
you walk in, you're like, oh my God.
What are all these noises?
Yeah, so many people and so many different, things happening at once. And not to scare you away, but I think it would be a good idea to go in and just, is this where I want to work? Like, is this the environment I want to be in?
Yeah.
Because I think I had never really set foot in one, and I just said, I'm going to nursing school. And then I got there and I was like, uh-oh.
Yeah. Yeah.
Yeah. So that's great advice. All right. Thank you so much for coming.
Yeah. Thanks for having me. This was so much fun.
Awesome. All right, guys. Thank you for watching. We shall see you in the next episode. Bye, guys.